Mpox is a disease caused by a virus. The virus's name is monkeypox virus. Scientists first found Mpox in monkeys. Later, they found it could make people sick too. Mpox is rare, but anyone can get it. Most cases are in Central and West Africa. In 2022, there was an outbreak outside of Africa. This made many people aware of Mpox. Even though it's called monkeypox, it's not just from monkeys. Other animals can carry the virus too. We're still learning about Mpox and how it spreads. It's important to stay informed and take steps to protect yourself.
Mpox spreads in a few ways. It can spread from animals to people. This happens through bites or scratches. It can also happen by touching an infected animal's blood or body fluids. Mpox can also spread from person to person. This happens through close contact. Contact with sores or fluids from sores can spread the virus. Touching contaminated materials like clothing or bedding can also spread it. The virus can also spread through respiratory droplets. These are tiny drops of fluid that come out when someone coughs or sneezes. Close, face-to-face contact is needed for this type of spread. It's important to note that Mpox is not as easily spread as some other viruses like the flu.
Mpox symptoms usually start within 3 weeks of exposure. The first sign is often a flu-like illness. This can include fever, headache, muscle aches, and fatigue. A rash usually appears 1 to 5 days after the fever. This rash can look like pimples or blisters. It can be itchy and painful. The rash often starts on the face and spreads to other parts of the body. This includes the palms of the hands and soles of the feet. The rash goes through different stages before scabbing over and falling off. Symptoms usually last 2 to 4 weeks. Most people recover fully without treatment. However, Mpox can be more serious in some people.
Section 4. Shielding yourself. Mpox prevention. Preventing Mpox involves avoiding contact with the virus. Avoid contact with animals that could be infected. This is especially important in areas where Mpox is common. Practice good hygiene to prevent person-to-person spread. Wash your hands frequently with soap and water. Use an alcohol-based hand sanitizer if soap and water aren't available. Avoid close contact with people who are sick. This includes not touching their rash or sharing personal items. Get vaccinated if you are at risk of exposure. Vaccines can help prevent infection or make the illness milder.
Section 5. Battling the virus. Treatment for Mpox. There is no specific treatment for Mpox. Most cases resolve on their own with supportive care. This includes rest, fluids, and over-the-counter medications to relieve symptoms. Antiviral medications may be used in severe cases. These medications can help shorten the illness and prevent complications. Your doctor will determine if antiviral treatment is right for you. It's important to isolate yourself if you have Mpox. This prevents the virus from spreading to others. Follow your doctor's instructions on isolation and other precautions.
Section 6. Staying informed, staying safe. Mpox is a rare but serious disease. It's important to stay informed about the virus and how to protect yourself. The CDC and WHO are reliable sources of information. If you think you may have Mpox, contact your doctor immediately. Early diagnosis and treatment can help prevent complications. By understanding Mpox and taking preventive measures, we can all play a role in protecting ourselves and our communities.